burns is one of the emergencies that we'll always respond to. And before I start this session, one of the things that I want to pause, or one of the concerns that you should note, is whenever you're responding to these burns, that you should not be distracted by the severity of the burns, or the smell of the burn, or the pain this patient is going through. Yes, you should be concerned of the pain, but you should not be much concerned about that, because in this you need to focus much on the life-threatening conditions. And how will you do that? It is very simple. If you know the pathophysiology, or the pathophysiology of burns, what is going on, what are the life-threatening issues, this should guide you in your assessment findings, in management. And in this video, that's what we're going to discuss. What are the issues that you should focus on once you're on the ground, once you have this patient? Welcome. Let's respond. Let's discuss about the pathophysiology. Burn shock is a type of shock that results from local and systemic response to thermal trauma. Now, let's look at the 6 pathophysiological concerns that as an EMT or paramedic, you should be looking at when managing this patient. The first concern that we should have is about airway and breathing. Number 2, dehydration, electrolytes imbalances, infection, hypothermia, and pain. Airway and breathing. Airway and breathing. One of the things that you need to do once you arrive at the scene is to ensure that the patient has a patent airway. So that is, you need to ask yourself, is the patient conscious or unconscious? As we all know, all unconscious patients cannot secure the airway. The trunk poses a risk of blocking the airway. On the other hand, when the patient is conscious, one of the things as a paramedic or an EMT you want to do is you want to check if there is any signs of swelling, especially around the neck and around the face. That we say anything that is will be happening to the face and the neck when it comes to swelling, then it is also happening to the airway. So that becomes our concern. The second issue that we are concerned when it comes to burns is the inhalation of hot gases and smoke. This can damage the airway and the lungs. Within minutes of major burns, all capillaries in the circulatory system loses the ability to retain fluids. In this, we say that there will be an increase in capillary permeability. This increase in capillary permeability prevents the creation of osmotic gradient between the intracellular space and the extracellular space. The process of burn shock will continue for about 24 hours, at which mostly the capillary permeability will be restored. Let's talk about electrolytes imbalance. In electrolytes imbalance, since there will be increase in capillary permeability, so this patient will not only be losing water from the system, but also sodium and potassium will be affected. Mostly will have a situation where you have this patient has low concentration of sodium and high concentration of potassium. Let's discuss about infection. As you all know, the skin is the first layer of defense. So in a situation where we have a big percentage of the surface area of the body that has been affected or has been exposed to burns, most of that function will be played. That it makes the body vulnerable. And apart from being exposed, another thing is the burns will affect the immune system. The patient will be at a high risk of getting infection. So that is another concern that you should have as a paramedic or an EMT. Hypothermia. In hypothermia, how will hypothermia come about? One of the functions of the skin is thermoregulation. So in a situation that you have this patient who has been exposed to serious burns, then the skin will not be able to perform that function. So you realize that this patient will be losing a lot of heat and the body cannot regulate that. So the end result will be you find that the temperature will drop, and at that situation that realize that the metabolic activities of the body will be affected. So most of the system will not be able to function properly because of the low temperature. When the patient is in a lot of pain, this will activate the sympathetic nervous system. So you realize that when the sympathetic nervous system is activated, then we'll have so many complications that such as nervousness and increased heart rate and all those other complications that would be brought about with pain.
Let's talk about the management of burns.
Your first priority as an EMT or a paramedic is to evaluate the ABCs once you reach the ground. Is the patient airway patterned? Is he breathing? And do you have a pulse? Giving the patient supplemental oxygen is highly recommended. But when you in your assessment, you realize that there's need for you to support in ventilation, then you don't have to delay on that. If inhalation injuries is suspected, or you see there are burns around the neck and around the face, then there's a need for you to observe the patient very closely for signs of impending airway obstruction. And if you are a paramedic, in this, we highly recommend you to weigh the option of intubating this patient. And for the EMTs, then there's need for you to call for the backup of the paramedic in time. On infection, we need to, once you arrive at the scene, you want to ensure that you dress all the wounds in time with clean dressing or sterile dressings. And remember, as you are applying the dressings, in this you're not applying direct pressure. So you need to tie the dressing loosely, not to compress, because it's not about, we're not stopping bleeding, but we're just preventing infection. So our dressing should be loose on infection. The next thing that you need to do is you want to start an IV line in time. Because we said that our patient is going to lose a lot of fluids, then there's need for us to start the fluids in time. When it comes to the solution of the choice, we highly recommend the isotonic solution. And in this, we highly recommend 4 ringers because we suspect this patient has lost so many electrolytes, and that will help to solve that. And when you're giving the fluids, you have to put in your mind the Parkland's formula, because now remember, you are the first person to interact with this patient, so you're the first person to give the first quarter. Use the Parkland's formula to do the calculation of the fluids. As we said, electrolytes imbalance is one of our concern. So when we have the electrolytes imbalance, then it is very easy for our patient to have these arrhythmias. That's why it is very important for you to attach the patient to the monitor so that you can closely see or monitor the dysrhythmia. And in case they develop, then of course you need to correct that either by cardioversion or use of the drugs and other options that you have as a paramedic. And if you're an EMT, then of course there's need for you to call for the paramedics so that he can work closely with you or with your medical director. Once you have this patient on the ground and you realize that this patient is in severe pain, then we highly recommend you to contact the medical director so that he can allow you to give the strong painkillers like morphine. But remember, most of these strong painkillers they are in the group of opioids. So they will have the tendency of depressing the breathing system. That there's a need for you, after giving such strong painkillers, then you closely monitor this patient for any signs of depressed breathing system. Once you have this patient and you realize that this patient is just from the burning process, so one thing you need to understand is your priority here should be, you want to reduce the effect of heat by lowering the temperature. That in that case you need to use cold water, or we say water at a room temperature. That you can, the options you have in your ambulance, you can use NS to cool the skin, but don't overdo it because that can lead to hypothermia. On the other thing is, you need to understand is, sometimes you can arrive at the scene late. So in that, when you see the patient is presenting with hypothermia, then you're not supposed to cool at that time. This time round, what you need to do is, you want to cover this patient after dressing the wounds. You cover the patient, and once you're in the ambulance, then giving your patient warm fluids should be the best option among, if you can have the heater on in the ambulance, so that can help to manage the hypothermia. In making the decision to where to take this patient to, you need to consider the seriousness of the condition, and again the facility, which facility will this patient benefit. So again, you ensure that you take this patient to a burn center. But again, as we say, sometimes if the burn center is too far and you realize that the situation is critical, then you can also decide to take the patient to the nearest facility for further stabilization. And again, from there, they can do the interfacility transfer. Burns to specific regions requires special considerations. Areas like the neck and the face, inhalation burns, burns to the extremities, and circumferential burn. Burns to the face and the neck normally swell very rapidly, and this can pose a risk of obstructing the airway. When you have this patient, have the bed elevated at least 30 degrees. This is to help in reducing edema. And please note, this elevation should be done when you don't suspect a spinal injury. If the burns involve the extremities, then you need to remove all rings, jewelries, and watch as soon as possible. This patient with circumferential burns, when these burns are in the extremities, then this burn can produce a tourniquet-like effect, and it can compromise with the circulation. Assess for the pulse below and above the circumferential. Big circumferential burn around the chest, then this can compromise with the chest movement, and it can affect with the breathing. In such a situation that we have a circumferential burn, then rapid transport is highly recommended. Thank you for watching. Kindly like my channel. Also subscribe for more videos. Share your comment on this video. Thank you very much.